To answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Thanks for being here, Dr. Moffitt.
Great to see you, Doctor. So, as you know, there are a lot of passions on both sides of this discussion about this issue. And superintendents will have big decisions to make about the face mask policy for their students, their staff, their districts. So what does the data tell us at this point?
Yeah, well, it's been pretty clear that masking has been one of the measures that have really kept transmission in our schools relatively low, even when community transmission has been high. Though I do agree that it's really time that we start planning for all of us as a society to move into the next phase of really living with this virus. But I think for COVID-19, those plans should include clear parameters that can inform when it is safe to dial back some of these measures. And I think that should include not just adequate vaccine coverage in the population or that community, but it should also include community transmission. And if community transmission is still high and no one indoors is masking, then our history with this pandemic tells us that case counts will likely rise.
Well, Dr. Moffitt, even though children have a lower risk of serious symptoms from COVID, that we know, there will always be a small number of students in each school who are more vulnerable. What do you want their parents to know who likely are anxious right now?
Yeah, first I'd want them to know that they're not alone. I've been hearing from a lot of parents that would fall into this group. But next, I would want them to make sure that their child has had all of the COVID vaccines that their child is eligible for based on their age and underlying conditions. And that's particularly true if their child has a compromised immune system. They should review with their provider that their child has had everything available to them to keep them protected. But next, I'd want that parent to know that if their child can comfortably wear a multi-layered, well-fitting mask for most of the day, that will still go a long way towards protecting their child, even if others in the classroom are unmasked.
So, Dr. Moffitt, science is important, data is important, but let's talk about real world. Do you think it's realistic to expect kids to need to wear a mask? They actually will wear the mask if no one else in class is wearing the mask?
Yeah, no, I think it's a great question. I think it will depend on a couple of things. First, it will really depend on the age of that child wearing the mask and their capacity to understand why it's important for them to still wear the mask. I think beyond that, the culture that is established around being very accepting of some children to continue to wear masks in classrooms will be really important. And that will come from the teachers and the school staff, but especially from other students. And that can even start with families having discussions now about why it's going to be important to still remain very respectful and accepting of other people's needs.
Absolutely. Okay, we want to get to this question from a parent. It's about testing. Corey writes, can Dr. Moffitt, you specifically, share any tricks to get my 3-year-old to sit still for a rapid test? As soon as I open the box, she screams and runs in the other direction. I know my own kids are still like, can I do the swab? You know?
Yeah. Yeah. Again, first I'd say you're not alone. Right. I have had a similar reaction from my 12-year-old when the rapid test has come out. So I would say first, and again, depending on their age, but really trying to have a conversation with them about why it's important that they're doing the test. It may be so that they can go back to preschool and be safe and keep their friends and teachers safe. I think beyond that, one thing that can be helpful is to give the child some sense of control over the process. That may mean that she holds an adult's hand while they swirl the swab, or maybe she gets to count backwards from 10 while the sample is taken or something like that. And when all else fails, bribery and positive rewards for the children for someone being brave to submit to a test can be one.
That's what I was going to say. M&Ms go a long way.
That's okay. Tell them all. I still run in the other direction when I see that swab coming my way, so it doesn't matter. Dr. Moffitt, great to see you. Thank you very much.